All right, welcome to this explainer. Today, we're focusing on something absolutely vital, especially for those of you who love spending time outdoors. We're going through a definitive guide for hikers on handling medical emergencies out on the trail. You see, when you're miles from the trailhead, you literally become the first responder. Everyday medical emergencies require swift, decisive action in those crucial first few minutes, way before mountain rescue or paramedics can even hope to reach you. It's all about having a structured plan, and well, that's exactly what we're going to give you right now. The entire core of what we're talking about today really boils down to this one quote. Your actions in the first few minutes when you see the signs of any of these conditions could help save a life. First aid on the trail isn't about being a doctor or, diagnosing some complex illness. It's simply about bridging the gap. Whether you're dealing with a buddy who has asthma or someone having a severe allergic reaction to a bee sting, what you do in those initial moments totally dictates the outcome. You can absolutely save a life. Okay, let's dive into this. Here is our symptom to action roadmap so you know exactly what we're covering. 1. Breathing and severe allergies. 2. Heart attacks versus cardiac arrest. 3. Fainting and low blood sugar. 4. Recognizing signs of stroke. And finally, 5. Seizures and mouth injuries. Starting right off with Section 1. Breathing and severe allergies. Before you even start assessing a symptom, remember the absolute first rule of the wilderness. Make sure the scene is safe. Right? Move away from steep drop-offs or trail hazards. Once you're safe, your immediate priority for any severe medical event is to grab your satellite messenger or phone and contact 911. After that's done, you want to look for visible signs of severe breathing trouble, say an asthma attack brought on by a really steep climb. Watch for abnormally fast or even abnormally slow breathing. Listen for a whistling sound as air struggles to get in or out of the lungs, or notice if the hiker can only gasp out a couple of words at a time. Usually, a person knows their condition and might just need you to step in and help them get their medicine ready. So, if they do need a hand, here are the exact mechanical steps to administer an inhaler. First, shake the medicine and pop it into the mouthpiece. Next, you'll have the person tilt their head back just a bit and breathe out slowly. Then, as they start to breathe in deeply and slowly, push down on the canister. Finally, have them hold their breath for about 10 seconds before they breathe out. It's a very precise sequence, but it ensures the medicine gets right where it needs to go. Now, breathing issues actually overlap with our next major trail hazard, allergies. A mild reaction might just be a stuffy nose or an itchy rash from brushing past some weird plant, but severe reactions, which often come from bee stings or someone sharing trail mix that has peanuts in it, can escalate into a full-blown medical emergency in minutes. You really need to watch out for trouble breathing, swelling of the tongue and face, and signs of shock. If things do go south and a severe reaction occurs, here is the safe, precise technique for deploying an epinephrine pen. And frankly, a hiker with severe allergies should always have one on them. Hold the pen in a fist. Never touch either end, because the needle deploys straight out of one side. Press the tip hard against the side of their outer thigh, and hold it firmly in place for 10 seconds. Pull it straight out, and then rub the injection spot for another 10 seconds. Oh, and this is absolutely crucial. Always note the exact time you gave the injection so you can tell the rescue team later. Moving on to Section 2, heart attacks versus cardiac arrest. High physical exertion on a tough hike can sometimes trigger severe cardiovascular emergencies. People actually get this critical distinction wrong all the time, but how you respond depends entirely on understanding it. A heart attack is basically a plumbing problem. Blood flow to the heart muscle gets blocked by a clot. The person is usually awake, but they're in pain. Cardiac arrest, on the other hand, is an electrical failure. An abnormal rhythm causes the heart to just quiver, meaning it can't pump blood at all. Within seconds, the person becomes completely unresponsive and stops breathing normally. Now, a blocked pipe, the heart attack, can actually lead to that electrical failure, and if that happens, that is when CPR is immediately required. If your hiking partner experiences a heart attack, you need to recognize the warning signs fast. We're talking discomfort in the center of the chest, pain that radiates out to the arms, the back, neck, jaw, or even the stomach. Look out for shortness of breath, breaking out in a cold sweat, or sudden nausea. If you see this pattern unfolding, do not let them brush it off. They might say, "Oh, it's just heartburn from the snacks," or "I'm just tired from the climb." No way. Rest them immediately and call for help. And while you're waiting for rescue to arrive, you can take this highly actionable step. If the person has no allergy to aspirin, no recent serious bleeding, and no signs of a stroke, have them chew and swallow 1 adult dose or 2 low-dose aspirins. Doing this during a heart attack can vastly improve their quality of recovery later on. Okay, Section 3, fainting and low blood sugar. Out on the trail, hikers are constantly battling the heat, fighting dehydration, and running on a calorie deficit. Fainting can happen just from standing up too fast after adjusting your boots, or just from pure heat exhaustion. If they're dizzy but responsive, the simplest fix is helping them lie flat on the ground so blood flow can return to their brain. Similarly, burning all those calories can cause blood sugar to plummet, especially for hikers with diabetes. Pay really close attention here. A diabetic person whose blood sugar drops might suddenly act irritable or confused. It's behavior that's entirely out of character for them. They might get hit with sudden weakness, intense hunger, sweating, or in really severe cases, they might even have a seizure. Catching these signs early on the trail is literally vital. So, what do? If you spot these signs, here's your immediate action step to restore their blood glucose. If they can sit up and swallow safely, give them glucose tablets, some juice, or sugary, chewy candy like jelly beans. However, if they cannot sit up or swallow, never force it. Seriously, they could choke. Just let them lie quietly, and if they don't bounce back in about 15 minutes, you absolutely must call for emergency help. All right, Section 4. Recognizing signs of stroke. A stroke happens when blood suddenly stops flowing to a part of the brain, either because of a blockage or a leak. Rapid treatment within the first few hours is essential to reduce brain damage and improve their chances of recovery. So you've got to memorize the FAST method. F is for face drooping. Does one side of their face droop or feel numb? A is for arm weakness. Is one arm weak or completely numb? S is for speech difficulty. Are their words coming out slurred? And T is for time. It's time to hit that emergency beacon or call 911 immediately if you spot any of these signs. And crucially, note the exact time when those stroke signs first appeared. Look at your watch. This is a vital administrative step that is so easy to forget when you're panicking in the middle of the woods. But giving paramedics and doctors this exact time gives them the data they need because stroke treatments are incredibly time-sensitive. Down to our final topic, Section 5, seizures and mouth injuries. Experiencing a neurological event on the trail can be super chaotic and honestly terrifying, but understanding what is happening allows you to act calmly and protect your hiking partner. A seizure is essentially abnormal electrical activity in the brain. It can cause a person to lose muscle control, fall to the ground, or just stop responding completely, often with jerking movements. While it's often caused by epilepsy, remember that out on a hike it could also be triggered by a bad head injury from a fall, severe heat stroke, or dangerously low blood sugar. Now, we need to forcefully bust a really common, really harmful myth right now. You do not want to put anything in a person's mouth when they are having a seizure. Actually, just totally forget those old wives' tales about people biting their tongues. Forcing objects into their mouth can cause broken teeth or severely block their airway. Your only job is to focus on protecting them. So here is your protective action checklist for a seizure. Move hazardous objects out of the way. On a trail, that means clearing away rocks or heavy backpacks. Place a small pad or maybe a rolled-up fleece under their head to protect it from the ground. Call for help. If there are fluids or vomit in their mouth, roll them onto their side. And if they did suffer a mouth injury during the seizure, just wait until the seizure is completely over, and then apply direct pressure to the bleeding area with some sterile gauze. Which brings me to my final question for you. So, what does this all mean? Are you ready to act decisively and safely in those crucial first minutes? When you're out on the trail, you are the lifeline. By memorizing these structured first aid frameworks, you aren't just a bystander anymore. You are capable, you're prepared, and you're fully ready to help save a life. Take these lessons with you on your next adventure, stay safe out there, and never underestimate the power of knowing exactly what to do.